I'm excited to be here today with Dr. Kotler, once again, the premier facial plastic surgeon and author, as we described, and inventor. Is a newer product, the Kotler Nasal Airway, which has been out a little while. I know that my father, Dr. Gerald Linder, who's a pioneer in the field of anesthesia with over 42 patents of anesthesia products, maybe have helped you a little bit with some of your ideas and maybe helped you along the way with some of your thoughts about this amazing medical technology and breakthrough product that's now being used all over the world. So,
right.
Dr. Kotler, tell us a little bit more about this.
Well, your father was more than a little help. He was a lot of help because, like everything else, if you haven't been an inventor before, you have to learn the process. And it begins with a thought, and then somebody needs to say, well, by the way, don't forget to get a patent and don't forget to apply for your FDA approval. And there's a step-by-step process, and he really took me by the hand and was an excellent mentor, and I really appreciate it. Well, we realized a few years ago that patients wanted to breathe better after any kind of nasal surgery, whether it be a classical rhinoplasty nose job or correction of a broken nose, correction of deviated septum. People who need sinus operations would benefit from it. And so basically we developed a soft silicone, that's the standard, a double tube system that just slips inside the nose, sits on the floor of the nose, and basically allows the patient to breathe even though there may be a little schematic here. Even though there may be packing, a little gauze put inside the nose or not, doesn't make any difference because the patient can breathe. And so for a few days, it could be 1 day, it could be 4 to 5 days, depending on the extent of the surgery. We did it to give patients a better experience because it's not much fun to feel clogged and like somebody put a clothespin on your nose for 3-4 days. And it was very well received by the first several patients that had it, and then we decided to kind of run with it and make it available. Interestingly and happily, it's made in the United States, manufactured right here in Los Angeles. All the production is made here, the wrapping, sterilization, shipped to doctors across the United States, and recently we had big interest in Korea. There's also there's a safety benefit to it, and that's very important because the anesthesiologist will thread a little soft tube through it and remove the blood and mucus so the patient doesn't have to cough and wheeze and be uncomfortable when they wake up or in the recovery room. So that keeps the anesthesiologist happy, and if they're happy, we're happy.
How long are these? How long is the tubes in for?
If it's a pure cosmetic procedure like the rhinoplasty, comes out the next day or the following day, and all we do is dribble a little liquid anesthetic in the nose, slides right out. It's soft, doesn't stick, it's not stitched in. It literally snaps into the floor of the nose, and the front of it is where the air goes in, and there's a little flush device that's included to keep it open in case it has a little blood or mucus. So it's very well tolerated, and the removal is easy.